Today I discuss about classification and clinical use of adrenoceptor antagonists. Subscribe, the Just Pharmacology, if not subscribed yet. Drugs that inhibit the physiological responses mediated by adrenoceptor activation are known as adrenoceptor antagonists. They are also known as adrenergic antagonists, or adrenergic blocking agents. Adrenergic blockers are subdivided on the basis of the adrenoceptor they blocks. We start with non-selective alpha blockers. Non-selective alpha blockers are Phenoxybenzamine and Phentolamine. Phenoxybenzamine is irreversible alpha blocker. It binds covalently to alpha receptors, causing irreversible blockade of long duration. The major use of phenoxybenzamine is in the treatment of hypertensive episodes caused by pheochromocytoma. Pheochromocytoma is a rare tumor of the adrenal medulla that secretes huge quantities of epinephrine and norepinephrine. Phentolamine is reversible alpha blocker. Phentolamine is a potent competitive antagonist at both alpha-1 and alpha-2 receptors. Phentolamine causes a reduction in peripheral resistance through blockade of alpha-1 receptors. Phentolamine has been used in the treatment of pheochromocytoma, especially intraoperative. Phentolamine has also been used to reverse the intense local vasoconstriction caused by unintended infiltration of alpha agonists of norepinephrine into subcutaneous tissue during intended intravenous administration. Alpha-1 selective antagonist. Alpha-1 selective antagonist includes Prazosin, Doxazosin, Prazosin, Tamsulosin, Alfuzosin and Silodosin. Selective alpha-1 blockers relax vascular and other smooth muscles, including those of the urinary bladder, urethra, and prostate. Because they produce vasodilation and decrease blood pressure, they are used to treat essential hypertension. Prazosin is highly selective for alpha-1 receptors as and used in the management of hypertension. Doxazosin and Prazosin are longer-acting alpha-1 blockers. They are used to treat hypertension or to relieve lower urinary tract symptoms in men with benign prostatic hyperplasia or BPH. Alfuzosin, Silodosin, and Tamsulosin are more uroselective alpha-1 blockers that relieve lower urinary tract symptoms. They are used exclusively for treating symptoms of urinary outflow obstruction due to benign prostatic hyperplasia in men. Alpha-2 selective antagonist. Yohimbine, an indole alkaloid, is an alpha-2 selective antagonist. It has no established clinical use. Beta-adrenoceptor antagonists. Beta-adrenoceptor antagonists or beta blockers are further classified as beta blockers as non-selective or selective. Non-selective beta blockers. The non-selective beta blockers were the first beta blockers to be developed for clinical use. In addition to blocking beta-1 adrenoceptors in heart tissue, they block beta-2 adrenoceptors in smooth muscle, liver, and other tissues. Nadolol, Pindolol, propranolol, and timolol are examples non-selective beta blockers. Beta blockers are used very heavily in the treatment of hypertension. The beta blockers lower blood pressure by blocking beta-1 adrenoceptors in the heart. They reduce cardiac output by decreasing the heart rate and contractility. Beta blockers also decrease the AV node conduction velocity, and increase the AV node refractory period, so they are also used in cardiac arrhythmias. Blockade of beta-1 receptors in renal juxtaglomerular cells inhibits renin secretion, which in turn reduces the formation of angiotensin II and the subsequent release of aldosterone. In the eye, adrenoceptor blockade reduces aqueous humor secretion and intraocular pressure. Blockade of beta-2 adrenoceptors produces several effects that can lead to adverse reactions in some patients receiving beta blockers, such as patients with asthma or diabetes. In the lungs, antagonism of beta-2 adrenoceptors can cause bronchoconstriction in patients with asthma. In the liver, beta-2 adrenoceptor blockade inhibits epinephrine-stimulated glycogenolysis and can thereby reduce hepatic glucose output during hypoglycemia resulting from excessive insulin administration. The beta blockers can also mask some of the early signs of hypoglycemia, e.g., tachycardia and sweating, which would otherwise alert a diabetic patient to this problem. Selective beta-1 blockers. Examples of selective beta-1 blockers include acebutolol, atenolol, esmolol, and metoprolol. Selective beta-1 blockers have a greater affinity for beta-1 than for beta-2 adrenoceptors. Because beta-1 adrenoceptors are primarily located in cardiac tissue, the beta-1 blockers are also known as cardioselective beta blockers. In comparison with the non-selective beta blockers, the selective beta-1 blockers produce less bronchoconstriction and other beta-2 adrenoceptor-mediated effects. Beta blockers are used for several clinical indications. We will study them drug-wise. Propranolol. Propranolol is used for the treatment of hypertension. Propranolol is used in angina pectoris because it reduces cardiac workload and myocardial oxygen demand. Propranolol is also used in cardiac arrhythmias. Propranolol is also used to prevent migraine headache and as adjunctive therapy in the treatment of acute thyrotoxicosis. In patients with Pheochromocytoma, propranolol is used to reduce cardiac stimulation caused by circulating catecholamines released from this adrenal medullary tumor. Nadolol is a long-acting drug. It is primarily used to treat hypertension and angina pectoris and to prevent migraine headache. Timolol is administered orally to treat hypertension, to reduce the risk of death in patients with acute myocardial infarction, and to prevent migraine headache. Ophthalmic solution of timolol is used to treat glaucoma. Acebutolol is a cardioselective beta blocker. Acebutolol is administered orally to treat hypertension and cardiac arrhythmias, especially the ventricular premature beats. Atenolol administered orally or parenterally and is primarily used to treat hypertension and angina. Esmolol has a much shorter half-life than other beta blockers and is administered intravenously to treat hypertension and acute supraventricular tachycardia when these occur during surgery. Metoprolol is used to treat hypertension, angina pectoris, and acute myocardial infarction. Beta-1 selective antagonists bisoprolol and betoxolol are administered orally to treat hypertension. Betoxolol is also used to treat chronic open-angle glaucoma. Topical ocular administration of betoxolol reduces aqueous humor secretion while producing negligible blockade of systemic beta-adrenoceptors. Adrenoceptor antagonists block both alpha and beta receptors. Drugs like carvedilol and labetalol block both alpha and beta receptors and are very effective antihypertensive agents. Carvedilol decreases blood pressure and has been used in the treatment of hypertension. It also decreases cardiac afterload, increases cardiac output, and reduces mortality in patients with heart failure. Labetalol is a non-selective beta blocker and a selective alpha-1 blocker that is primarily used in the treatment of hypertension. Like, share and subscribe the channel.